During these unprecedented times, employers are finding new ways to provide resources and support for their employees and their customers, and we'll hear about some of those efforts today. We're thrilled to work with our member companies, leaders in business, state government, nonprofits, higher education, as part of this Massachusetts Caregiver Coalition, working to support family caregivers everywhere. I want to acknowledge Mark Butler, president of Cigna Health New England, for his leadership in helping us launch this unique and growing Caregiver Coalition. We invite you to join us. Please, if you haven't already, send us an email. We'll put up the links on ways to get more involved with the coalition, and we would love to have you join our group. This is the third in our free webinar series to raise awareness, share stories, and provide practical resources to support volunteer family caregivers. June, as many of you know, is Alzheimer's and Brain Awareness Month, and the coalition is proud to address challenges and support the critical work that caregivers are doing on the front lines during these really difficult times. I want to thank you all for being here. I want to thank you for sharing your strength, your hope, your anxiety, your vulnerability, and all your stories with us. And I want to thank you really for the work that you do every day. Following this webinar, please let us know how we can help, what topics you'd like to see us cover next. To get things started, I want to just do a brief shout out to Tom Croswell, who's the CEO of Tufts Health Plan and a member of the Roundtable's executive committee. He connected me with our moderator this afternoon, Jim Wessler, CEO of the Alzheimer's Association, Massachusetts and New England chapter. And when we decided we wanted to focus today's webinar on Alzheimer's and dementia and brain awareness, Jim was my first call. Under Jim's leadership, the chapter has grown to one of the largest and most effective chapters in the Alzheimer's Association, directly serving over 40,000 people annually. Jim was appointed by Governor Charlie Baker, who himself and his administration is working to make Massachusetts the most age-friendly state in the nation. Jim was appointed to serve on the Massachusetts Alzheimer's and Dementia Advisory Council. It is now my pleasure to introduce Jim and ask Jim to please help us get started. Thanks, Jim.
Thank you, Chris, very much. And thanks to the Massachusetts Business Roundtable for hosting this panel. As we delve into the issues that the family caregivers and those of you in the workplace are dealing with when it comes to Alzheimer's and dementia. And as Chris said, welcome our participants to Alzheimer's Disease Brain Awareness Month. This was a month actually adopted by the Alzheimer's Association a few years back to promote brain health and awareness about Alzheimer's and dementia. To just kind of get us grounded, I want to just show you a graphic here, our facts, what we call our facts and figures, you know, partly just so that everyone's sort of on the same page here in terms of the impact that Alzheimer's disease is having. It's obviously a global disease, but here in the US, you can see it says more than 5.5 million. It's actually about 5.8 million Americans today are living with Alzheimer's disease. It's the 6th leading cause of death in the United States. In addition to the 5.8 million Americans, there today, it's about a 3-to-1 ratio. So it's about 16 million Americans who are providing unpaid care for someone with Alzheimer's disease. And this is an expensive disease. So in addition to the human toll, it's costing today our nation about $305 billion in healthcare costs. And unless we have disease-modifying treatments by the middle part of this century, it's going to exceed $1 trillion. And just one other point here that you can see, 50% of primary care physicians believe that the medical profession is not yet ready for the growing number of people with Alzheimer's and dementia. So this is an issue impacting families, and it's also clearly an issue impacting our healthcare providers, and they themselves have identified that we need to do more. So in addition, we can go down on this slide here. So in addition to the just the general impact that Alzheimer's disease, Alzheimer's and related dementias is having, we have the overlay today of COVID-19. And it is a really challenging combination. If you just look at what's happening in nursing homes, an overwhelming percentage actually have dementia. We see what's happening, at least in Massachusetts, and this is across the country, 60% of COVID-related deaths took place for residents living in nursing homes. We saw this directly at the Alzheimer's Association, just kind of a sobering micro story. We started up soon after everybody was working from home. We started up a video conference support group for family caregivers of a loved one in a nursing home. And within 2 weeks, that about 11-person caregiver group experienced 100% mortality of the loved one that they were there to talk about, who was in a long-term care facility. So in addition, obviously, to what's happening in long-term care and assisted living and other care facilities, the toll of family caregivers, and of course our healthcare professionals. And Brent Forster, if we have time, may chat about that as well. He's done work on that. This is just really hard. We know that millions of American caregivers, and I'm sure many of you who are participating today, either you yourself personally or if you're in HR or EAP program, you know that employees in the workplace are not immune to this at all, and that it is a big strain when you're taking care of a spouse or a parent or another loved one with dementia, and you're also doing your best to work every day. So hats off and great appreciation to the members of the Massachusetts Business Roundtable for your efforts to celebrate caregivers and frankly to recognize the importance of supporting family caregivers, particularly as it affects their lives at home and also their work in businesses across the state. So I want to move pretty quickly now to our panel. We have an awesome panel for you this afternoon. What we're going to do is we're going to hear from each panel member. I'm going to be posing some questions to them. We're going to get some hopefully interchange, and then you have the ability, there's a Q&A and a chat feature at the bottom of your screen, and you should feel free as we go along to pose a question, and to the best of our ability, we'll try to take some of those and answer that. So I'm going to introduce our panelists, and hopefully they'll appear on the screen. Dr. Brent Forster, McLean Hospital. You saw their bios earlier, so I'm not going to go into that. Leonor Bertrego of the Alzheimer's Association, and Dr. Molly Perdue of the Alzheimer's Family and Support Center. Welcome to you all. There we go. We got them all. Okay. So Brent, I'm going to start with you, Dr. Forster. And I know you and I have talked about this, that caregivers, particularly in this day of the coronavirus, they themselves are undergoing immense strain, and their mental health, sort of their well-being, is often doesn't get adequate attention, and you've talked about that and the importance of that. Do you want to expound on that a little bit?
Sure. Thanks, Jim. And I just want to thank you and Chris and others for inviting us to be here today to talk about this important topic and hopefully provide some important information to you all. So as Jim mentioned, this pandemic has disproportionately impacted not just older adults and not just individuals living in long-term care facilities, nursing homes, and assisted living, but specifically the patients with dementia. Individuals with dementia represent a disproportionate high percentage of overall mortality related to COVID-19. And I think all of us who are probably on the panel today, and Jim mentioned their experience at the Alzheimer's Association, we've all known people who are older with dementia who succumb to this illness. So the two areas where I think caregivers in particular have been affected have been those of you who are caring for loved ones at home, and all of a sudden there's no access to the resources you were used to having, day treatment programs or other support or getting a break, etc. And also those in long-term care where there's been really an inability to visit loved ones and to have that same type of interaction, social interaction and connectedness. So it's raised all sorts of issues. And to get to your question, Jim, The things that I worry about as a psychiatrist who treats people with Alzheimer's disease, but spends a lot of my time thinking and worrying about the family care partners, is what are some of the key emotional symptoms and behavioral symptoms to frankly watch out for. So we know that even in normal times, in non-pandemic times, individuals who are care partners of loved ones with Alzheimer's disease experience rates of depression that are quite high, and their own physical health and emotional health is deeply impacted by caregiving, as is their own risk of death. And that's in normal times. And in the setting of the pandemic, although we don't have the data yet, other than some early survey work and some anecdotal reports, but what I would watch out for in caregivers and care partners are symptoms such as sleep disturbance and difficulty with feeling overly anxious and worried, perhaps about things that you normally wouldn't worry about, increasing irritability, feeling sad and down in the dumps. And a lot of this is related, frankly, to the trauma that we're all going through. You know, some people have written beautifully about how this is really an extended grief response, where we've gone through these stages of grief and the losses that we've experienced, not just physical losses of people who have passed away, but our own losses in our own lives and our connection to our families and our friends. So the experience of grief, which brings up a whole host of emotional and psychological symptoms, is really important to pay attention to, and to actually try to take care of yourselves. And maybe we can talk about this more later on, but some of the key things that you can think about doing to take care of yourself, because you have to be very proactive about it, you know, especially during these times.
Thank you, Brent. I appreciate that. And yeah, I hope we can come back to that. Leonor, I want to turn to you now. And I know that as a manager of diversity programs and outreach at the Alzheimer's Association, you work a lot, particularly with the Spanish speaking community, Latinx community, and we know there's a disproportionate impact for particularly for Latinx and African Americans. So I'm wondering if you can talk about, is there a difference in perception of Alzheimer's and dementia from diverse communities? And then maybe just from your personal perspective, what are some of the challenges that the COVID-19 has imposed as in terms of working with caregivers, again, in diverse communities as they grapple with dementia and the coronavirus?
Yes, just to give people an idea, about 13% of Hispanics 65 and older are diagnosed with Alzheimer's disease, and I think part of to complement the data that it was shown at the beginning, Hispanics and African Americans are at higher risk to develop Alzheimer's disease. And in terms of the perspective, Alzheimer's is perceived as part of normal aging, so this leads to a delay in a diagnosis. People only go to see a physician when the symptoms are more apparent, when they have difficulties dealing with the family member, difficult behaviors and other symptoms. And also there is a stigma with this disease, and it's hard for people to talk about the disease, especially at their companies, at the place of work. It's very difficult, and also to friends and family members because of the stigma. So people feel more isolated. And in some groups, we have seen also that Alzheimer's is seen as God's will. So medicines are not going to be of any benefit, especially when we tell people that the disease doesn't have a cure at the moment. So we inform people, we try to raise awareness about the disease, the symptoms, and what are the services and programs available. But at the same time, we need to be mindful of the culture and respect the values. And talking about the challenges, Dr. Forrester just mentioned that one of the first challenges is access to services for caregivers. They have limited services. If they had a family member, their loved one in an adult day health care, that is not working at the moment, or any other type of service is very limited. Other challenges that they're facing is the changes in their routine because the family is together at the home at this time. Some Latino families live in a multi-generational households. So that complicates a little bit the dynamic of the family and also the quality of care for the person with dementia, and increases the stress for the family caregiver. And one of the other challenges that caregivers are facing now, especially at the time of COVID-19, is following the guidelines from the CDC. Because a person with Alzheimer's, obviously they forget about washing their hands, so they have to be reminded every time. They have to go with a caregiver. It's one more task that the caregiver adds to their the daily tasks that they have to do with caring for someone with Alzheimer's. And the other recommendation from the CDC about social isolation. Because we always recommend people to go outside with a family member, take a walk, enjoy the nature, especially now that the weather is nice, and now they have to be isolated at home. So I would say that those are the main challenges.
Okay. Thank you, Leonore. Molly, Dr. Perdue, I want to turn to you now. And just maybe you could give us some thoughts, particularly with your great work on Cape Cod, which is how to approach the care for a loved one, whether they're living at home or the challenge of in today's environment with someone in long-term care and all the restrictions involved with that. But what's some of your advice and guidance for caregivers?
All right. Well, thanks, Jim. I've always wanted to work beside you, and here we are on Zoom. So
That's right.
So I want to thank the coalition, the Roundtable, Chris, Paul, everybody, the other panelists. You know, I'm really excited to be on the webinar today because, you know, for 8 years, the way that I got into this work is that I was a caregiver. And what COVID reminds me of is I can remember one day when I was taking care of my mother at home in Provincetown, and we were informed that there was going to be a hurricane. And I said to her hospice worker, oh my gosh, like, what am I going to do? My mother is on hospice, she's bedbound, and we're right near the beach. Where would we go? And the hospice worker was kind of perplexed because nursing homes were pretty filled. There was not really anything. And I thought, well, you know, if a hurricane's coming, we'll get my kids out of here, and my mother and I will be the last ones on the boat. And the pertinence of that story is that what has happened since COVID has come into our neighborhoods and in our communities is that caregivers have been left with less support. And if you thought Alzheimer's and dementia was more complex before COVID, it has gone, you know, exponentially off the charts. So supports that people are able to kind of connect to in their homes can be, how do you reduce isolation? And Brent, you talked about that. Lenore, you've talked about that. But the isolation that goes with caregiving someone for Alzheimer's and dementia, it's already pretty big. And when you say, okay, the COAs have closed their doors, the day programs have closed their doors, you're not sure about how home health agencies are going to function going forward. As Jim pointed out, you know, you're talking about COVID-19 rates that are very, very high in facilities. You can see that the backdrop for Alzheimer's dementia families becomes very, very difficult to kind of navigate. So, you know, some of the things that we have looked at for folks is that on Cape Cod, we were lucky in the sense that we had a home office. So we wanted to connect everybody. We started connecting folks daily with emails to try and, as you said, Jim, get good information out there from, you know, from the governor's office and make sure people understand how to stay safe. We know that that's one issue that affects everyone, and the information such as if you had someone in a long-term care facility, that outdoor visitations started. You know, this is information that we want everybody to be able to know, because it can change, or at least it can bring up some of the issues that people can grapple with. And every change that every family is dealing with, it requires some support. So in looking at support services, it is critical that people are able to reach out from their home. And we know that if we look at the demographics of Alzheimer's and dementia caregivers, we know that they are not considered Zoomers, right? These are not the Zoomers. These are people that may be a little tentative about technology. I mean, this is my first webinar. I don't know about you guys. I know some of you have probably done many of these, but you know, this webinar is new for even us. And so trying to help families get connected, to try and talk them through. So the one thing we did is we found someone very young that could walk everybody through how to get on Zoom, how to do it. And so we're finding that we're getting 90-year-olds, 85-year-olds, we're getting, you know, people that may otherwise, I'm waiting to get my first 100-year-old to get on Zoom and do something on our Zoom groups. But, you know, it's a way for people to get connected and talk about things like, how do I pick a home health agency? Do I, you know, how are we doing testing? Are people getting tested before they come in the home? Do I have to worry about opening my doors to an agency? What are agencies doing? And we've tried to figure out how to collate and kind of distill some of this information for our families, because there's so much of it. There was a day where I was trying to find some type of information about the reopening to send to our folks on the Cape. And truly, we could send this to anybody. If you guys want to get on our mailing list, you can get the information we're sending out. But we wanted to connect people and find, well, what do you do if you're a high risk, in a high risk category as a caregiver, and you want to make sure that you're not doing everything that a 20-year-old is doing. If you're allowed to go to a restaurant, should you go out and sit in an indoor restaurant even though they're open? So we're trying to help people think into how to kind of figure out how to assess their own risks and assess who they're caring for and what they're doing. Contingency planning is really important. So when you're thinking about risk, you have to think about, what am I going to do? And just to give you a quick story, we had a caregiver that had to go to the emergency room, and we couldn't leave the person with dementia home. And we were able to figure out, through us and a COA that was working together, to get a neighbor that went over and stayed with the person with dementia while the other person went to the ER. And then we were able to get on the phone a family member that was having to drive all the way from Georgia to get to Cape Cod to be there with his mother. And so we were able, through, you know, 2 agencies and through the fact that we were trying to do all this online communication, we were able to construct a contingency plan that actually allowed everyone to be okay. So we have a lot of those cases. We had a case of a COVID positive folk that was living in a town and didn't want to get to had called us, but didn't want to get to the hospital. Knowing what we know, we have a public health nurse on our staff. We said, you have to get there. If you have to take your person, you have to get to the hospital. And thank goodness we did. They were hospitalized, but they were able to come home. And so I think if you're thinking about how COVID makes things more complicated, we know that contingency planning was always important with these families, but now we know it's vital. It's critical.
Great, thank you. I know stories are really quite helpful. Thank you, Molly. Hey, Brent, we had a question earlier, and 2 things for you. One of which is, I know you get this all the time. Someone asked, what's the difference between dementia and Alzheimer's? And then very different than that is the follow-up that you had said. And I know that both Molly and Leonore touched on this a little bit, but you know, what are steps that people can do to take care of themselves? And I know you've talked about, in addition, that both caregivers and a person with dementia will ignore, Molly was sort of giving her last story touched on this, will ignore other healthcare issues because of their fear of interacting with the healthcare system given COVID-19. So Alzheimer's versus dementia, and what can people do to take care of themselves?
So yes, we get this question a lot, so I'm glad someone asked this question. So think of dementia as a clinical syndrome. It's a series of symptoms that are characterized by a decline in memory or some other aspect of cognitive functioning from someone's previous baseline. And along with that, it affects their daily life in some meaningful way. So it disturbs their ability to take care of themselves, to pay their bills, to drive. It could be any number of functional limitations. So you combine a memory loss or other cognitive problems with a functional decline, and you have this clinical syndrome of dementia. Dementia is an overarching term caused by many specific diseases. The most common disease causing this clinical syndrome is Alzheimer's type dementia. And that's characterized in the brain by these plaques and tangles that form that lead to a destruction of brain cells and the symptoms you see. It probably accounts for 2/3 of all the dementias, which is why we often use the terms interchangeably and confuse everyone. So I'm glad you asked the question. But there are many other causes of dementia that are due to specific diseases, including the vascular type of dementia, which is caused by small strokes or large strokes in the brain, or the Lewy body type of dementia, which is a different brain pathology that can cause symptoms that look a lot like Parkinson's disease, actually, or frontotemporal dementia. And the list goes on, and there are probably 60+ causes of dementia. And again, Alzheimer's is the most common, and we can talk more about that if folks are interested. The second question, which is more specific to now, is that I think what we've been seeing in general, not just in individuals with dementia and their caregivers, but also in general in society, is that people are afraid to go in for medical care. This was especially true early on in the pandemic, in the months, at least around here in Massachusetts, in the months of March, April, and even into May. The overall hospitalizations for heart attack, for stroke, and for other treatments for cancer just plummeted. And it's not like COVID cured these problems. Actually, people were just afraid to come in for help. And so we don't really know how much of the death toll that's been reported is actually due to under-treatment of preventable other medical problems, some of which may have been acute, like a stroke or a heart attack, or others which may have been due to chronic illness that was poorly maintained. But I think what's really important is that even though primary care and psychiatry and other medical professionals moved to remote care, care is still available. And so all of you who have physicians and other clinicians caring for ongoing illnesses, in particular primary care physicians, are not only accessible, but they're often more accessible than they used to be. Because setting up, I can talk from psychiatry's perspective, moving from in-person care to virtual care has been like a revelation in many ways, because all of a sudden we can intervene in a much more effective way. Older adults in particular don't have to worry about driving and parking and walking. In the winter, it's going to make things easier because we now have no more no-shows. People show up for their appointments. And to get to, I think Molly or Lenore, I can't remember now who was talking about this, but Molly, you were talking about in terms of engaging some people who don't know how to use these technologies. We've been actually able to redeploy our research assistants to provide tech support to get them onto Zoom. So if it takes 15 minutes or 3 hours the day before the appointment, we can teach folks how to use the technology, and then they can use it with their family as well to connect. So I would definitely avoid ignoring health concerns. And in terms of whether to go in or not, now that at least in Massachusetts, we've opened up to being able to go in for some even elective procedures and some routine care like dental office visits and ophthalmologic visits, it's important to reach out to find out what the plan is. And then finally, I'll just say is one thing I've really noticed is that everyone has their own degree of risk tolerance. Like, what risks are they willing to take? And how do you now think through the risk-benefit ratio of any of our decisions, going to the grocery store, going out for dinner, visiting a loved one when able to, or even going in for your own health care? I will tell you that hospitals, primary care offices, the medical community is probably much safer than walking into a grocery store. There's so much attention paid to infection control. I've been back 3 times in the last week for a dentist, eye appointment, and a chiropractor, and I'm pretty risk averse, and I felt very comfortable. So I think it's really important to weigh your own risk tolerance, talk to your providers, and don't ignore regular health concerns.
Hey, Brent, I want to ask you just a follow-up question. We got a question about, someone was asking, if you're a caregiver, how do you tell the difference between what might be COVID-related symptoms, where the person seems to be not feeling well, maybe less engaged, and what might be a progression of Alzheimer's and dementia?
Yeah.
So
So
I don't know if you have thoughts on that.
yeah, I have a lot of thoughts on that. So this is an area which is really interesting, and one that we're just starting to really try to explore to understand better. But you know how people with dementia often will become all of a sudden confused and have a behavior change, maybe become agitated, maybe become overly sleepy, but all of a sudden it seems as if they've fallen off a cliff. And then prior to COVID, we would often think, well, maybe they've got an infection, like a urinary tract infection, or maybe they've got the flu, or maybe they have a, you know, their blood sugar is going up and down and they're a diabetic. So we would always look for medical explanations of these, you know, more rapid changes in mental status and thinking and memory and confusion and behavior. Now with the prevalence of the coronavirus in society, what we've seen, frankly, is that the first manifestation of COVID infection is actually a behavioral change or an increase in confusion. This is actually not uncommon at all. I've seen it in a number of my patients as well. One individual who was living in a long-term care facility, and the first manifestation of COVID was aggression towards a staff member one weekend morning during ADL care. Was getting shaved, and then he punched somebody and was sent to the emergency room for the behavior, not because he was physically sick. And they did a COVID test, because if you walk into an ER now, you get a COVID test, and it was positive. So he was one of these asymptomatic positive people. But sure enough, within 48 hours of going home with his loved one, because nobody would provide 24/7 care for him back in the assisted living, she couldn't get him out of bed, and he couldn't walk, and he became more confused, and unfortunately developed a very severe illness and passed away within a week of being diagnosed. So it may be that these subtle changes in mood or behavior or thinking and memory could be the signs of COVID. It doesn't mean you should overreact or worry more than usual, but any of these symptoms at any time should really beg a medical workup. And part of that workup today, standard care, would be a test for the coronavirus.
All right, thank you. Leonor, I want to turn to you now. I know we hear, and I know I've heard you say in the work that you do, that people say, well, why should why should I get a diagnosis, and why, what's the advantage of getting this done early? What it is. I think you said did you say something like this is God's will or something like that? And you can't do anything about it. So, why should we even pay attention to it until it gets really severe? What's your thinking on that, and what do you advise families?
Yeah, this is one of the challenges that we have in the community, especially because of the perceptions that they have about Alzheimer's. So we try to raise awareness about the importance of an early diagnosis. It's important because they can benefit from a treatment. It's also important because it opens the possibility to participate in clinical trials in order to find a cure or a treatment or a better diagnosis. And something that is very important, I would say, especially for the Latino community, is planning for the future. We like to enjoy our daily lives. We just think in the present, but we don't have the habit of planning for the future. And I always say, if you want to have peace of mind today, you have to plan for the future. We have to have a step here and one step in the future. So, and with this disease, it's very important to planning for care. If I have Alzheimer's, who's going to care for me? Who's going to provide care? Who's going to make the decisions, legal and financial decisions and medical decisions? So there is a lot of planning involved that is particularly relevant to this disease.
Okay, thank you. Molly, and I want to remind our participants, throw some questions in the Q&A. If we won't know about them unless you share them with us. So, Molly, I know among a lot of the great work you're doing, you've done sort of the flip side when we talk about what's happening in nursing homes is in many ways, sort of the trauma that our professional healthcare workers are dealing with. And just wondering if you can just, you can talk about what you're doing, but just talk about that even as a issue. Is that something we should be concerned about, and what can we do about that?
Oh, yeah, I think that in facilities that have had all these COVID cases, I think people are traumatized. I think there's like a PTSD of seeing so many people that are in facilities that may have do not resuscitate orders that are going to pass away. I mean, we here at the Alzheimer's Family Support Center had 2 weeks where we lost one of our clients every single day. And, it takes a toll on you as a professional, and clearly for the nurses and CNAs and social workers in facilities, they are going through this. We started a program called COVID Conversations, where we actually brought in a social worker that's a grief worker. She ran grief support for 30 years at a hospice, and she worked with the professionals. And then we brought in Elaine Abrams, who's our public health nurse, to talk about issues. And I'm going to be doing actually one of the sessions on self-care. And so we're putting this out to different facilities because I think they do need support. The other thing that we did is early on, when we started getting these numbers from the state, from DPH, we thought, well, what can we do to try to boost morale? And I think sometimes, in the medical world, it's hard to then think about the social world that kind of intersects, right? So we thought, let's make this program called Cards of Hope. And because people in facilities are isolated and because people are not doing things, let's safely get cards that say, we know this is hard, we're rooting for you, you can do this, to not only people that were living in facilities, but for the workers. So we started delivering after we disinfected and let things sit for weeks. We received cards and we sent them out to facilities on Cape Cod. And you can't see my chair behind me, but we're disinfecting another 600 cards that we're going to start moving out. And it was a way to say, we know this is hard. We're here for you as your community, and we want to be a part of doing something. And so I think that there are things like that we all can do that don't endanger anyone, that help us come together as a community, help us figure out how to support each other. And the professionals really, really need that. And the one thing I wanted to say to Brent's, you had mentioned sleep disturbances, and you had mentioned as far as people that were starting to deal with COVID symptoms. And one of our standards is that because we know that people with dementia can get urinary tract infections and not have fevers, or can get pneumonia and not have fevers. And we've had people that were COVID positive that did not have a temperature. So what we always do is say, get some medical help immediately. Call your GP, and see if you can get, some type of telehealth. Don't wait around. And I think that has actually, we know that it's probably saved some lives, just disseminating that standard of care of, if somebody is not having the ability to walk, and yesterday they could, we know that Alzheimer's and dementia usually progress a little more slowly, but these are acute changes. Call your medical provider. And those are things that we're trying to do, to get the word out. One other quick thing I just want to throw out there is that one of the things we're doing, because we know that we all need information, this is a novel virus, is that we have brought Teepa Snow to do a webinar. And Teepa Snow is an occupational therapist that does dementia training. And we have geared an online conference that will cover everything concerning COVID. It can cover how people should be taken care of within nursing facilities and assisted livings. We are covering how to help people get online with Zoom and use these video chats better, more effectively. We're talking about the effects of social isolation on caregivers as well as people living with dementia. And so, it's going to be a free conference, and it's also a give back to those professionals that still have to get their CEs during the time of COVID. And so we're going to hopefully, with all of you helping us, get the word out so our nurses, our social workers, the people that are really doing the heavy lifting of the COVID crisis, get them these free CEs and get them trained around dementia.
That's great. Perfect. Thanks, Molly. We have a lot of good questions that have just come in. One thing, and Molly talked to you about that terrific conference. The Alzheimer's Association has also just a whole array of services, programs, a lot of it today online. Leonor is one of our wonderful staff that delivers these. So that connection is in the chat. We have a special added section for living with dementia in this era of the coronavirus. And we have a 24-hour helpline. Literally, you can call 24/7. I know there was a question about what can employers do. And so certainly you can share this information, what I just said about the Alzheimer's Association resources, what Molly shared about the conference coming up, Dr. Brent Forrester and all of his incredible colleagues, if you're here in Massachusetts, but certainly at McLean and at the Brigham Mass General network are phenomenal. We at the Alzheimer's Association routinely do lunch and learns, and we can do these virtually as well. So this is where you would have a gathering of employees. We just did one last week with Bank of America, and I think this is a nationwide webinar. We had over 1,000 employees logged on to that. So that's all available to you, and just reach out and work to us. I wanted to get to a couple other questions. Leonor, one for you, and then Brent, I'm going to come back to you. Someone asked about a research, what's exciting. So I'll give you a few minutes to think about that. But Leonor, question for you about, we talked a lot about caregivers, and I'm wondering, particularly your work with Latinx communities, does that have a different connotation? Is there, even the language we use, is from your experience, how do we approach that? I know for many caregivers in different cultures, it's not considered something special. It's what we always, what families do. So help us out thinking that through, particularly as we're dealing with Alzheimer's and dementia.
Yes, especially in the Latinx community, caregiving is seen as a duty. Part of our duties are daughters and sons to care for our family members, and people also care for their family members at home, which is, as I said before, we have to provide options. As at the Alzheimer's Association, we provide options of other resources that families may have when the disease progresses, like a residential care, there are adult health care, there are other supporting services, but traditionally families care for their loved ones at home. So as I said before, we have to respect the culture, but it's important for people to be informed so they can make better decisions. I just want to say, for example, my husband had one of his employees, a senior engineer. He started having issues with taking days off and being on the phone the whole time. And it's difficult for people to open up about a diagnosis and tell that they have a family member with Alzheimer's, but he spoke. So when my husband shared that, I shared the information packet to call the helpline. So he got a care consultation. And making story short, with this disease, there is no happy endings, but at least employers and employees can have an agreement, can have flexibility in their schedule. And the most important is, as Jim mentioned, is to have the resources available. And I would say in an ongoing basis, because of the stigma of the disease, people might not have them at the time they need it. So it's good to remind people that these resources exist. And besides the helpline, as James mentioned, we have also support groups for caregivers. We are doing virtual programs in Spanish and English, and we have one in Haitian Creole coming up. It was kind of difficult to set up these programs because, as I think both of the panelists mentioned, the difficulties with technology from our communities. So people have the opportunity to participate by phone or video conference as well. And another thing, another resource that I would say for employers and employees is volunteering. I think at this time of the year, especially what is happening in the country and in the world surrounded health inequities, I think it's very important to support charities who embrace diversity, support charities. It can be in many ways. One of the things that it can be done is volunteering. And I would like to invite all of you who are watching us today to volunteer, look at our opportunities, the opportunities at the Alzheimer's Association in our website. I think it's going to be on the chat. We have different opportunities, from fundraising for our main event that is coming in September, that is the Walk to End Alzheimer's, being part of the committee, and also advocacy. We are advocating for laws that improve the quality of care of families living with dementia, and research. And my favorite volunteer opportunity is working with the community. We are doing these virtual programs, especially looking for volunteers who speak Spanish to deliver these programs.
Thank you, Leonora. And I'm glad you did loop that back earlier to the workplace. And I know in planning this this webinar, we talked about how, I think as at least an American society, it's the norm that our workforce has childcare responsibilities. That's kind of accepted, but the idea that their elder care responsibilities has been slower to pick up. And again, hats off to the Massachusetts Business Roundtable for hosting this today, but it is a real challenge. And I hope if there's any takeaway message that you've heard from Leonora and from Molly and from Brent and myself, is that there are resources available to you. And the worst thing you can do with this disease is not reach out for help. There are a lot of very smart, well-intentioned organizations and individuals out there. Brent, I wanted to, I know time is limited here, but we did earlier get a question, and maybe we can, maybe, I don't know if this is our closing comment, or maybe we'll give everybody a chance for one last comment, but is there anything positive and exciting happening in the research space? Because we got a question about that. Is there any hope in the future?
Yeah, thanks, Jim. So I think there's a lot of hope in 2020 about this, about where research is going to hopefully take us in terms of finding an eventual cure for Alzheimer's disease. So I wanted to mention two things. First of all, and by the way, I tend to be an optimistic, glasses half full kind of person. And when we talk about diagnosis, as Lenore and Molly were talking about, the importance of early diagnosis is critical. And instead of making a diagnosis and throwing our hands up in the air and saying, well, you've got Alzheimer's disease, there's nothing we can do, in 2020, in the hands of expert providers of dementia care, the focus really is on what we can do and not what we can't do. How do you maximize someone's quality of life and keep them functioning well, and supporting them and their caregivers? So two things I wanted to talk about. One is, for those of us who don't yet have dementia, or don't yet have any kind of early stages of mild cognitive impairment, there's actually a lot that we can do to keep our brains healthy with aging. And there's a tremendous amount of research on this. And the Alzheimer's Association's been funding this research for many, many years. You guys have been out front on this, Jim, and I really applaud you and the National Institute of Aging on this. So there's some basic things that we all can do. But the two most important things, well, there are really three things that I think about. Number one, is paying attention to our diet and nutrition. This can be really helpful. The Mediterranean diet, where we limit our intake of red meat, and we have more fish and omega-3 fatty acids and green leafy vegetables, and all the things you might imagine is good for your heart. Well, it also happens to be good for your brain. The second thing is exercise. I think of all the studies that I've seen, all the data that I've come across over the years, both in terms of prevention as well as for people with cognitive impairment, exercise not only can reduce anxiety and agitation and irritability and improve mood, but it also has some modifying effects on cognition and may slow cognitive decline and may even prevent or delay the onset of cognitive decline. And then the third thing is really important is social connection. And this is where today's pandemic becomes challenging. But, you know, the more people interact with one another and really realize the beneficial effects of being with other people and important and meaningful relationships is really critical. And I can list other things. There are a lot of keys to successful aging, but those are three of the top ones. The other area, though, that I do want to mention is that once people have symptoms of Alzheimer's disease, or even the earlier stages we're calling mild cognitive impairment, there is so much work going on right now, funded by a pharmaceutical company, by the federal government, by the Alzheimer's Association, and other philanthropic organizations and individuals to try to find either a disease-modifying treatment, which basically slows down the course of decline and allows people to live more productive lives and engage with their loved ones and functioning better over time, or even prevent the onset of symptoms in the first place. And so the areas of research have really been focused mostly in the past decade plus on the abnormal protein deposits in the brain, the amyloid plaques and the neurofibrillary tangles that are associated with the physical manifestation of Alzheimer's disease. The most promising of all of this is a compound that has been manufactured by a company in Cambridge, Massachusetts called Biogen. This product was in a two phase 3 clinical trials, like the stage right before really approval by the FDA in March of 2019, when the company realized in an analysis that they had decided to do ahead of time that the drug didn't seem to work. Well, after looking at more data with a larger population and looking at people who got to the highest dose, it turns out that it actually is effective in slowing decline in people who get to the highest dose for a period of time. So as we speak, Biogen is requesting from the FDA a review of an application to get this drug approved as what would become the first disease-modifying treatment for Alzheimer's. We have a lot of symptomatic therapies on the market. There are 4 that are widely used, including the one that you probably know of called Aricept or donepezil, but there are 4 that we use, two different classes. Those help with symptoms, but they don't alter the course of the illness. This would actually probably alter the course of the illness and could provide a lot of hope in preserving not just more years of life, but better years of life. And that really would be the goal. So keep an ear out and an eye out for information about not just aducanumab, but other medications that are in various phases of trials. But the real issue we have right now is there's more funding than ever for Alzheimer's research, as we know. It's finding willing participants. And as Lenore said, one of the reasons to get an early diagnosis is so you can do something about it. And getting enrolled in a clinical trial gives you the opportunity and your loved one an opportunity for actually becoming a candidate for one of these trials and getting the support that comes with it. The research teams that work with individuals and families provide a lot of support that I think that I've seen in my experience have really helped families out a lot and patients.
Great, thank you, Brent. And we have something called Trial Match that online can connect you to clinical trials actually anywhere in America. And I also want to mention, Brent, the Alzheimer's Association actually is directly funding and running a study called US Pointer. I won't go into what the acronym stands for, but it is a lifestyle treatment. And we're looking to enroll 2,000 people. And the 5th and last site is actually going to be opening up in Providence, Rhode Island for New England. So for those of you who are in this area, there's some possibility there. So I'm going to go around, Molly, I'm going to start with you and say, just thinking that many of the participants on this webinar this afternoon are working for Massachusetts or other companies in America, might be in a human resource role or an employee assistance role. And so that, they have a responsibility for the health and well-being of their workforce. So for each of you, what is, in 1 minute, that's about what we have for each of you, what is kind of one takeaway you would want them to take back and be able to consider as they work with their employees?
Well, I think, clearly supporting caregivers of people that have Alzheimer's and dementia and getting people connected. We do some research through New York University where we've actually used Zoom as a platform to do family meetings and to try to create some type of social safety net for every family that's caregiving. And I would say that this research of supporting families has been well documented since 1986. And I'm starting to see some of the funding going for these social supports that we know have a tremendous influence on how a family does. And, you know, with Brett and Lenora, you know, depending on your cultural background, you know, this is what you do for your families. You care for them. And so trying to figure out how to provide this support right now for employers and for employees, it's really critical. And because of COVID, we've made it so much easier because we can get people hooked into these meetings online. So I think being able to reach out and connect to support places like what we do, what you do, Jim, at the association, it's so important that everyone is not in their own vacuum trying to navigate all of the complexities and all of the uncertainties that have just been, you know, exponentially increased because of the COVID crisis.
Great, thank you, Molly, and thank you so much. Leonor, 1 minute, what's a one takeaway you would give to our audience here from the Mass Business Roundtable?
Sure, I would say that as everyone have said the same thing, sharing the resources with employees is very helpful. You never know when you're going to need information. And also encourage volunteerism in your organizations, because we need more to raise awareness about the disease. We need more support for our families, for our caregivers, and a good way to put a grain of salt. I don't know if it's a grain of salt, a grain of sand is taking some time to help others. I think it's a good way.
Great, thank you, Leonor. Dr. Forster, what's your 1 minute of takeaway advice?
I would just say that for those of you who have loved ones with dementia, there's help available. I think my years of working in a memory clinic and in various settings in long-term care and outpatient land, my colleagues at the Alzheimer's Association have an amazing program called the Dementia Care Consultation Program, and they provide a lot of support and guidance for families along the way, almost like one-stop shopping if you need a place to go. The other thing I would say is that what we're missing right now in healthcare is a systematic way of finding people early enough so we can make a real difference in their lives. And I think that starts in primary care. Regardless of background or where you live, the primary care community is really not set up or situated to really help right now. And so I think some of the work that we've been starting in our system, Mass General Brigham, I think will try to achieve the goal of embedding teams of experts within primary care to help with early diagnosis and treatment. So look out for that. And I guess my last word of advice is reach out for help. Don't suffer in silence. There are a lot of people going through what you're going through. And if there's any question about, is this Alzheimer's, is this a memory problem, is this something else, there's a lot of help that can be realized by a careful assessment.
Okay, well, thank you. Dr. Forster, Dr. Perdue, Leonor, to the panelists, yeah, a terrific job. I think quite informative. I know we could have gone longer. I appreciate you taking the time out this afternoon. I'm going to turn this back to our hosts at the Mass Business Roundtable.
Yeah, and thank you, and to Jim and Brent and Leonor and Molly, thank you so much for your time this afternoon. Thank you to all of the audience for participating in today's webinar. My name is Lawrence Stuntz. I'm the director of the Massachusetts eHealth Institute at the Mass Tech Collaborative, and we helped launch this coalition because of the tremendous public health implications of caregiving and the impact that caregiving has on a family caregiver's ability to work. On average, a family caregiver who's over 50 years old will lose $300,000 in lost wages of benefits. And that's money they'll never get back. And that can have a massive impact on the rest of a caregiver's life. So to address these challenges, we want to ensure that caregivers know that resources are available to help them and ensure that employers are aware of the impact of caregiving so that they can support the family caregivers who are working for them. We have a mantra in the coalition. We want to recognize, honor, and support family caregivers. And in order to do that, we posted resources at the Roundtable site that will flash up at the end of this talk that employers can use. And we created this webinar series to provide information and to engage employers and caregivers. So please tell us how we're doing. Tell us what you want to hear about by answering the poll that's now on your screen. And after you leave the webinar, please take 30 seconds and provide us with some quick feedback. Thanks again to Jim, to Leonore, to Molly, and Brent for the great conversation, and to Chris and the Mass Business Roundtable and all the members of the coalition for helping to organize today's webinar and for pushing forward with this cause. We look forward to you joining us, and thank you very much for your time.